This is the award-winning Lee Pitts Live.
Brought to you by Lee Health.
Hey, Southwest Florida, welcome to another edition of Lee Pitts Live. And me? I'm Lee Pitts, of course, the host of the show for 26 years. And I'm glad you put us on your list of things to do. Where are we now in Southwest Florida? Well, we're at the Sidney and Barron Davis Art Center and nestled in the beautiful downtown Fort Myers on the River District. We have a fabulous show in store for you. We'll get a chance to find out all that's going on in the area as it relates to the health department. We're going to come here and talk about some interesting things. Get a chance to talk to Jennifer Roth. She's with the department, the health department in Lee County. We'll also get a chance to talk to Terry Harder with the health department in Collier County. Also in the show, Girl Talk is here. Tashika Perry is here as usual with her great guest. She's going to have Marian Kearns from the PACE program up there in Collier County. All that's happening on Lee Pitts Live. Keep it locked. We'll be right back. Southwest Florida, we're so thrilled to have here some of the Florida Department of Health's finest here to educate us. Let's bump them in. Jennifer and Terry, welcome to Lee Pitts Live.
Thank you for having us. Happy to be here.
Good to get you here on this Sunday morning. The health department has done such a tremendous job in keeping us healthy and aware of things that are going on here in this part of the country. Florida has some unique things that always seem to come to bear because of our climate and so on and so forth. So it's very good to get both of you here to talk about some of those things. And one of those things is Zika. When I see that word Zika, I get real nervous. I'm like, there's something out of some kind of virus coming from Mars that's going to kill us all. But that's not quite the case, Jennifer, is it? What is Zika?
Well, Zika, as most people know, it's a virus that was spread mostly through mosquito bites. So that's our biggest concern, of course, is that there might be infected mosquitoes that we're trying to prevent. And the one different thing about Zika is that it can also be spread from mother to child if a woman is pregnant, and also through sexual contact as well. So there's lots of different ways and avenues that Zika can be spread. So we're definitely trying to get the message out there about prevention.
How about symptoms? Anything people should look for? Go ahead, you can go to that.
Okay. I think the biggest symptoms that we always talk about are fever, rash, joint pain, and conjunctivitis or red eyes, like the whites of your eyes kind of turn red. So fever, rash, joint pain, and the red eyes are the four big things that we're really looking for if people have symptoms.
And I'm staying with you again, here in Florida, if we have all that water and all that settling water, that increases our chances of dealing with mosquitoes, right?
It can increase the number of mosquitoes.
In the heat.
Yes, and so we do have the perfect climate. Now, not every mosquito can spread Zika, so just because there's an increase in mosquitoes doesn't necessarily that means there's going to be an increase in disease.
Okay.
And of course, a mosquito has to be infected first by biting somebody with Zika. So if we don't have any disease happening right now, the biggest problem mosquitoes are going to cause are just be a nuisance for biting you. But we always want to make sure we're reducing our mosquito population.
Very good. Now, Terry, we're talking about Zika, but there are other things that can happen as a result of mosquito bites as well, right? Other diseases? Please expound.
Yes. There's a couple of diseases, chikungunya and dengue fever, which are spread by the same mosquitoes that transmit the Zika virus. But there are also other diseases, West Nile virus and Eastern equine encephalitis, which are spread by a different type of mosquito, but those are found in the United States.
What are some concerns about Zika as it relates to pregnant women?
Well, some pregnant women that have been infected with Zika virus during their pregnancy have had infants born with birth defects. And the birth defects can affect the infant's vision and their hearing. And severe birth defect would be something called microcephaly, where an infant's head is much smaller than an infant typically would be at birth.
I see. Who are most likely at risk for the Zika virus? Mosquito viruses in general. Jennifer?
Well, in general, so we are of course worried about pregnant women and Zika, but additionally with the other viruses out there, such as West Nile virus, Anybody who has a compromised immune system, so whether you're elderly or have some kind of other disease that might be causing a compromised immune system, for example, cancer patients going through chemotherapy also might be at risk. Those people are much more likely to have symptoms since the majority of people who get these diseases have no symptoms and they have never knew they had it and they'd be fine. But anybody at a higher risk, like the elderly, immunocompromised people and pregnant women, they're much more likely to have symptoms, and if they do have symptoms, they're more likely to be severe.
I see. What should a person do if they think that they have some of the symptoms, Jennifer?
Well,
go ahead.
the first thing that they would do is they want to get evaluated by their healthcare provider, because you don't know for sure if you have a mosquito-borne illness unless you do get evaluated. The other thing we would recommend is that they stay indoors. We don't want our mosquitoes biting them if they are infected. So wear mosquito repellent, stay indoors, and get evaluated.
I see. The health department and mosquito control work together on a wide range of things. How do you work together as it relates to controlling mosquitoes?
Yeah, we have a really great partnership with our local mosquito control agencies here in Florida. So what happens is if we get notice that somebody might have a mosquito disease, and even if somebody imported, so somebody goes and gets Zika in Brazil, for example, if we get the notification from a doctor that someone has possibly has one of these diseases, we call mosquito control so they can go out and spray and kill all of the mosquitoes that might be living near that person so that they can't bite that person and then spread it locally as well. And the mosquito control also does a wonderful job. Every week they're doing surveillance. They have a program where they look at local chickens and they take blood from local chickens actually, and they can determine whether or not there's West Nile virus or the Eastern equinocephalitis, those other viruses we see in the United States. The chickens can let us know if those are circulating here locally.
Very good. How can we prevent mosquito bites? Back in the day, we used to put on some baby oil. In Alabama, we just come up with our own remedies. But and then of course off. But what is there more to that, Terry?
Well, we do encourage everyone to wear an insect repellent, preferably containing DEET.
Containing what?
DEET.
What is that?
DEET.
It's a special something.
It's a chemical that will kill the mosquitoes.
Okay.
And there are other plant-based things, oil of lemon eucalyptus, other things that you can use to repel insects.
So you don't recommend a particular product. People can go out and find their own product. You're just saying,
Right.
make sure it has some DEET in it.
It should be EPA registered product.
You want to expound on that?
Yeah, so if, like she said, it has to be registered by the EPA to say that for sure it's going to be
Just
effective.
read the label.
So you just got to read the label, exactly. On the bottom it'll have an EPA number on it, and that's how you know that it's actually been registered to be effective.
So we're going to have mosquitoes with us forever, so we may as well figure out how to do it. I mean,
Exactly.
Like I think you were mentioning that, you kill the mosquitoes, but they still come back every year, right?
Of course, yeah.
Do mosquitoes live year-round here in Florida all the time?
Yes, we have year-round mosquito activity. The mosquitoes themselves only live about 2 or 3 weeks and they die off, but an individual mosquito only lives that long. But yes, unfortunately, we're warm and wet enough down here in South Florida that we have year-round mosquito activity.
Is it fair to say that what we have going on in Lee County goes on in Collier County as well? Because
Yes.
it's very similar in proximity?
Yes.
Okay. How does Collier County and Lee County health departments work together? Trying to get you talking. Go ahead.
Well, we work very closely because we are neighboring counties. So if something's going on in Collier County, I will let Jennifer know that what's happening so that they can do surveillance and monitor for the same thing to happen in Lee County.
Well, lady, we're so proud that we got people like yourselves in place to keep us healthy and safe around here. Keep up the good work, okay?
Thank you very much.
Okay, as the saying goes on this particular show, for those who say it can't be done, they're usually interrupted by those like these fine ladies from the health department who are doing it. When we come back, Girl Talk with Tashika Perry.